Hello everybody, welcome back to this channel. This topic is gonna be all about the medical case that you are probably gonna see in Johannesburg and what I personally saw there. It's for sure something completely different what I personally been used to. It was a very refreshing new experience, a very big new experience. It has, of course, its advantages and disadvantages, but all in all, I think that something is for a specific type of person very useful, and that's something you're gonna find out at the end of this video. So as you already know, I did trauma surgery in South Africa, in Johannesburg, to be very exactly at the BARA hospital. It's just short term, a short name for the long name, Chris Hani Baragwana Academic Hospital. So we just make it short and say BARA. It's the biggest hospital in whole Africa, and I think it's already the third biggest as hospital in the whole world. It happens a lot that I just lost myself somewhere in this whole big premises. It's something you need at least a good GPS and some internet, or just get used to the day-to-day roads that you're gonna walk with the whole team. I went to trauma surgery or trauma unit because I want to do trauma surgery as well when I finished my studies and graduated. So it's nothing that is new to me because I worked in the trauma unit in Germany in my university in Frankfurt, and I learned a lot. I learned how to suture. It helped even out in some operations. I'm actually very used to. But there's a big difference between not every European country, but many European countries. The difference is on the focus of the trauma unit or trauma surgery in Germany and South Africa. Because in Germany, trauma unit or trauma surgery is more focused on the whole muscular and bone tissue when something is broken, or the consequences of accidents or violence. So it's more concentrated on the muscular tissue and bone fractures. But trauma surgery in South Africa or many other countries in the world in general, they are focused more on the abdominal part. It's more about the organs. The damages of those organs can be the consequences of accidents, of violence, of shooting, of stabbing. Both sides have the reasons for why they have other focuses. At the end, it just come actually very well together if there is a trauma surgeon who can actually operate on the stomach, on the intestines and so on and so forth, but also can work or operate on the bone and muscular and everything else, because that's important as well. They get fractured and damaged just the same amount as the intestines or the whole stomach area. It would be the perfect trauma surgeon if he can operate on both sides, but it's almost impossible because of those many subspecialties and so on and so forth. So it's very difficult for just a human being with a normal lifespan to learn that everything in a very proper manner. It's kind of difficult, so you need to decide after time where you want to go. But despite those differences, I decided to go there because of the big reputation that the trauma unit in BARA has, and that is high influx of patients with consequences or victims of violence or of accidents, and that the students are very well from the get-go already a big part of the team, are taking over some responsibilities like checking over patients and taking care of them. Suturing is on the daily list, admitting patients by the permission of the attending doctors, and so on and so forth. You are already part of the team and you learn a lot when it comes to responsibilities, accountability. If you are somebody who wants to learn that, even in the time of your studies, just want to do an elective over there, just to get the experience early on so you can benefit from them for the professional future. So I can recommend BARA Hospital, where you can learn big time responsibility, big time accountability, of course the practical things like suturing, putting chest tubes in. So if you're somebody who's looking for that, that is a very good address for you. So the medical cases that you are being faced over there is Of course, violence, consequences of violence and accidents. For example, shooting, stabbing. That's something you almost see every day there. You need to look out for pneumothorax, hemotothorax, of course bone fractures. But once it comes down to a fracture and nothing else, nothing that could kill the patient even quicker, you just stabilize those bone fractures and admit them to the orthopedic trauma surgeon. It's a very specific subspecialty of orthopedic. It's called orthopedic trauma surgery. Once they got a bone fracture, and that needs to be taken care of, and it needs to be quick, or maybe can take some while. At the end, you need to admit them to the orthopedic trauma. But once they got issues with their intestines or with the lungs, they are a bit unstable, they're still the patients of the trauma unit and need to be stabilized by the trauma unit first. After that, they're gonna get to the ward until they get better, or in the ICU. If that is even necessary. What you can see as serious cases over there are, for example, an elderly person or even a young person who got shot in the torso, in the lungs, in the chest, in the stomach, or in the leg, and they are bleeding and are screaming from pain. That's something that often the students with the attending doctor are taken care of. If the person got a hemothorax or pneumothorax, you can also get the chance to put a chest tube in, and that's something that I did sometimes, not as much as I liked. You got the opportunity to do so, to learn from that. That's also something that you can do if you want to do. It depends on how you act or how you demand those opportunities, because the doctors are not interested to give you everything they have to one student who is not even showing no kind of interest in their kind of work. So it depends absolutely how you act, how you present yourself, and how you deal with those things. Another serious case that you are being faced there is, for example, people who are getting burned. This is also a big problem in Johannesburg. People are living in tiny shacks. Of course, they are trying to cook there and for a meal for themselves and the families. After that, they just get burned for some reason, explosions because of the leaking gas, many other reasons. Some of the cases that you're gonna find over there are burning victims that you're gonna see over there. Even though they got a burning unit, which I never actually saw, to be honest. I just saw this whole sign like burn unit, but I never saw a doctor from there. Once they are stabilized by the trauma unit, they're gonna maybe admitted to the burn unit. It depends on how stabilized the patient is, if they got a chance of surviving or not. But don't think that it's complete hell over there with only serious cases. There are many normal cases, quote unquote, if you are used to in Europe. For example, people fall and just sprain their ankle or something like that. Nothing very big, seriously. But you can take care of those kind of patients just to get in rhythm, like getting people admitted into the trauma unit, just to evaluate those patients, to get a proper plan how to deal with those patients, and just take the responsibility for them. The best thing that I actually really appreciated about taking care of patients by yourself, with, of course, a attending doctor on your back, that you're gonna present this patient also by yourself to the whole team to the next ward round. And once though they're all attendings and consultants are coming together, and if you're lucky, even the chief of the unit is coming, and you can present this patient to the other doctors, and they're very nice, very understanding, but still they want to have this work done properly. So they're going to ask questions. How does it come that you think that way? Why do you actually think that is necessary? Things that you can do for this patient, or is this thing done? Have you documented that right? Just to get you prepared for the real deal after the studies in the real professional world. So that's something I really appreciated. So big time accountability that you're gonna learn over there. And there are also some very special things that you're gonna see over there, like a thoracotomy. A whole chest is ripped off or cut through by the doctors because there is a big bleeding. They need to clamp those vessels very well. That's something you can see, but of course you're not gonna take or be part of anything of this. You are gonna have many other practical opportunities like suturing in the pit. That's something you're gonna enjoy. You're gonna suture as much as you like. You're gonna suture even more as you like, so you don't even like any more about suturing, but you're gonna be almost a half master in suturing. That's something that I really appreciated. Something else that you're gonna learn over there are putting chest tubes in, putting central lines in, and those opportunities are very valuable for the future profession that you want to take. For example, trauma or anesthesia or ICU and something like that. That's something that is very valuable for those kind of professions. So we come to the conclusion, or something that I already announced at the beginning. From my point of view, this kind of opportunity, this kind of elective is very valuable to medical students that want to do trauma surgery at the end, or something like anesthesia, or ED dogs, emergency department dogs. Those are the three, I think, main later professions that I would recommend to go there. But if you're just someone who wants to check it out, even though you want to do something like general medicine, so you just want to take those experience, and it's useful for almost every other specialty in medicine, that is accountability, responsibility, and any others end with ility. So it's something that you're going to appreciate at the end very well. At the end, I really enjoyed my time there. There's going to be another video just to conclude this arc completely, to give you my complete conclusion about my time there, what I personally learned about it, and what you can learn from those videos.